playing softball, and me and a girl collided. I was a second baseman, and the shortstop ran into me. I fell on the ground, and they carried me off the field, and they ended up doing an MRI and saw that there was a piece of bone had been floating around hitting a nerve, and they did a laminectomy. That was my first surgery. That was by an orthopedic surgeon. All of a sudden it just started getting worse, and I'm a very active person. I'm not one that sits around and does anything. So the doctor decided that I needed another fusion. So he did 3, 4, 5, and S1. It didn't go well. I was still in pain. It happened in July, and I was still in pain in December. So I just didn't want to go back and have that surgery over again. So I was talking to my sister-in-law, Julie, who works at Royal Oak Beaumont in the operating room, and she referred me to Dr. Fahim. It was her doctor, and he took care of her, and she has no pain now with her surgery. And I thought, well, it's got to work for me too then.
When I first met Cindy, she told me about how she'd previously had lumbar spine surgery. She had an operation by an orthopedic spine surgeon who performed kind of an old-fashioned traditional operation where they do an open operation. They dissect all the muscles and ligaments off of the spine to be able to see what they need to see and do what they need to do, which is commonly done. It's still commonly done today by lots of spine surgeons all over the country. But unfortunately, sometimes when you have that kind of operation, you develop something called adjacent segment disease. When multiple levels of the spine are fused and some of the supporting structures, the muscles, the ligaments, and all these things are destroyed by virtue of the fact that they had to be destroyed to do the operation in that old-fashioned way, sometimes people are predisposed to developing a problem above that area of their operation or below that area of the operation. It can happen even without that type of surgical approach, but I think it's much more likely to happen when you have an old-fashioned open spine operation like that. So anyway, she began experiencing these symptoms of pain in her back whenever she was moving, and her MRI showed that she had an abnormality just above the area of her previous fusion. This is a common problem when you have old-fashioned open lumbar spine surgery. To fix that problem, we designed a minimally invasive operation to address her issue just from the side. We made a little incision along her side, and we were able to stabilize her spine through that minimally invasive operation using a tube to access her spine, to stabilize her spine without even making a cut anywhere on her back. And she did just great with that operation. She went home after a day or two, and her back pain was relieved, and she felt tremendously better.
I went to see Dr. Fahim 2 weeks after my surgery at the Michigan Head and Spine Institute. Everything was going really well. I was off my medication. This is a truck that my brother-in-law made. He wanted the parts from my surgery, and I thought it was kind of odd that he would want the pieces that came out of my back. So Ray decided that he would put these into a vehicle, and I have the smokestacks and the screws and different parts that came out of my back.
So if I had met Cindy before she'd had her first operation, I would have performed her first operation in a minimally invasive way, which probably would have prevented her from even needing a second operation. That would have been the best case scenario. But a lot of times patients come to me after they've already had lumbar spine surgery by someone else in the old-fashioned way, the old open traditional fashion. And those things can be addressed then with minimally invasive spine surgery to try to fix them and restore them to a normal quality of life.
I'm not taking any medication now at all, so I'm really happy I'm able to play with my grandkids and sit on the floor and do things that I used to do before.